We are back on Morning Line. Thanks for joining us. Our guest this morning, malpractice attorney Clint Kelly. Always good to have him on. Talking about cases and the like. And actually, we had James who waited through the break. Let's take his phone call before we get into some of the other cases you want to discuss. And James, good morning. How are you, James?
Good morning, guys. How are you?
Good. What's on your mind, my friend?
All right, I got two because I discussed this with a friend a few months ago, and I really didn't have a good answer for him, so maybe he does. I actually have two, so hang on a minute.
Okay.
The first one is virus and flesh-eating viruses that can be destroyed with a UVD robot. And the second one is if you're having a child and there's an issue during birth and it takes longer than 12 months to figure out whether they did something wrong with the child or a pediatric doctor can figure it out, are they still liable?
Okay. All right. Well, let's go on both of those. I don't know what his question was with regard to the flesh-eating virus, but I mean...
It sounds like he's asking, is there a treatment or is there a way to prevent what is necrotizing fasciitis? I believe that's what he's talking about, which it is a bacterial organism.
Okay.
You've probably heard about people who've had the flesh-eating bacteria.
Scary stuff.
It moves quickly. It causes gas gangrene inside the area of infection. You can have people that just cut themselves. All right. This bacteria invades like Green Berets, and they can go in there and just like wipe out a city. They can wipe out an area of someone's limb, their arms or legs. The tissue it like liquefies and dies, and by the time they get to it, the question is, how much of your limb have you lost before they were finally able to stop the infection? Sometimes you have to literally cut the meat out to get all of the Green Berets out, so that what's left is tissue that hasn't been invaded.
You can lose part of your leg.
Yes, and so people, the best advice is if you get a cut or a wound of any kind, first of all, you make sure that you get antibiotics, or like Neosporin or whatever, and clean it out properly, and you keep a close eye on that thing. If that thing begins to turn pinkish or red and warm, you go to a doctor or hospital immediately. Because I've had a patient lost her arm up to her shoulder, necrotizing fasciitis. Also had another one lost a foot. The problem with the foot was she got to the hospital in plenty of time. They just blew it.
Oh, really? So you had a case?
They didn't diagnose what it was. They thought it was cellulitis. Turned out to be the flesh-eating bacteria, and she lost her foot.
Now that's still, you're right. We see it, and it makes news when it happens because it's frankly terrifying. But it's not exactly commonplace, right?
Yeah, and he was talking about UV light. So you can install these UV light lamps into your AC system, and it's supposed to be able to kill bacteria as it makes its way, and viruses, it makes its way through the air system. I've got one of them.
Really?
Yeah. You just literally drill holes into the return where the air's coming in, and they're these long, look like fluorescent lights and long skinny tubes. Two of them will go out, and it makes it so bright you can't look at it because it damages your eyes. But it has the effect of killing bacteria and viruses. Second question you had though about babies, great question. With a child, the statute of limitations is 3 years. So you've got 3 years to wait on that one. And you can generally know by the time the child's getting close to 3 which way that's going to go. If there's a serious birth issue, that child's not getting better. And again, that's a situation where what you were talking about, you can always give pre-suit notice. That gives you more time. And you can look at it, and if it turns out to be something where the kid gets better and it's not going to be a case, you can dismiss your lawsuit. But that's, James, that's 3 years on the child instead of 1.
I just have to have you talk about the one case we did involving a child and the birth and the surgery that was done underneath the tongue.
Yeah, that is...
This is interesting. Listen to this one. This is a story we did a few years back.
We had a baby. It was born at a local hospital, and the baby had a... under her tongue, that tissue under the tongue, it's a frenulum. It's called a frenulum, and so you've heard tongue-tied, right? Some patients are tongue-tied. Well, one of the babies that was born was clearly tongue-tied, and an order was given for that baby to have a frenulectomy, where they take scissors and just
to loosen it up, and that's the proper procedure, standard of care for that.
Yes, it is. The problem is the doctor got the wrong patient. And what they're supposed to do, Nick, is have a timeout procedure where they do 4 things. They identify the patient, the body part, the surgical instruments involved, and who's the right doctor. Okay? They have to do all 4 of those things. Well, in this case, they did not identify the patient.
So the doctor goes to the wrong baby.
Operated on the wrong baby, cut the wrong baby's frenulum.
Now this is a baby, it's not tongue-tied, things should be fine.
Was not tongue-tied, should have been fine.
How was it discovered by the family? I mean, they wouldn't know, I mean, did they know it happened? The mother wasn't there at the moment, or how did it play out? I'm trying to recall.
Baby was brought in to mom's room for her normal breastfeeding. Mama looked at the baby's mouth, and there's blood, little blood scrapes right here and in there. She looked inside the mouth and could tell there's been blood up under the tongue.
That's
She's like, what happened to my baby?
Yeah.
And then the doctor comes in there sheepishly, because that's kind of the guy he was, comes in there, puts his head down, and made the nurse tell the patient what happened. You know, there's two things. It's bad enough to have a medical mistake like that happen to you. What compounds it is when the doctor won't man up and just tell the patient, put his arm around the patient, say, ma'am, it's going to be okay, instead of hiding on one side of the room and letting the nurse go in there and disclose this to the patient.
You've said on more than one occasion, when there's a clear mistake and the doctor comes in, is apologetic, is going to do everything to help in all this, sometimes that mitigates the damages and what that mother or whoever seeks beyond it, because you're treating them with respect.
Or the patient won't sue.
Or the patient may not sue. The patient may say, look, everyone makes mistakes. Now, in this case, we should say we don't believe the child suffered permanent damage, fortunately. I mean, that's disturbing. Any mother seeing a newborn with a procedure that shouldn't have been done in a bloody mouth is going to be very upset.
You know, the truth is, Nick, we're never going to really know for certain whether this child had any damage done to the ability to speak or eat because of the age of the child, and there aren't any forward-looking studies where they study patients after they've had a frenulum
So you'll
cut.
never know what it would have been like later.
Not really. I couldn't prove it.
Could they fix it?
We couldn't disprove it. No, it's gone for good.
It's good. So this ended up being litigated. Was there a settlement? How did that play out?
I can only say it got resolved.
Okay, yeah.
To the satisfaction of the parties. That's all I can say. What I can tell you, though, is this is so preventable, but it happens more often than people think, where either the wrong patient gets operated on or the wrong body part gets operated on. And I've had several of those cases, and they're becoming more numerous because of what we talked about earlier, assembly line medicine, where the margin of error is shrinking, and in particular, surgeons are not spending enough time ensuring that they've got the right patient or ensuring the right body part is marked.
Right.
You know, if you've got 10 surgeries that day,
right,
and you're trying to whip through them, and maybe what you've got on your mind is, you know, left arm arthroscopy or whatever, and it turns out the right arm was the one that needed the surgery, and you just kind of get in the mode of, you know, we all get modes, Nick, of kind of just walking through.
Of course, it's human nature.
Robot. That's why you follow policies.
Yep. That protects you from making the mistake. That's why they're in place.
It protects the patient. It protects the surgeon. If you know, a policy is no good if you don't follow it.
Right. Good note to take a break on. Our policy is to follow going to commercial break so we can pay for the show. We'll be back. Linda and others on hold. Stay there. We'll get to your phone calls right after this.